Hi, my name is Julie Lenza. I'm a student at Touro College, and I will be discussing autism spectrum disorders. Autism spectrum disorders, also known as pervasive developmental disorders, are developmental disabilities that can cause major behavioral, social, and communication challenges. Autism spectrum disorders are autism, Asperger's syndrome, childhood disintegrative disorder, Rett disorder, and pervasive developmental disorder not otherwise specified. There are different degrees of autism and autism spectrum disorders. Autism is a brain development disorder characterized by impaired social interaction, verbal nonverbal communication, and restricted repetitive stereotyped behaviors. Asperger's syndrome is characterized by significant difficulties in social interaction and nonverbal communication, alongside restricted and repetitive patterns of behavior and interests. Childhood disintegrative disorder is a rare condition characterized by late onset of developmental delays in language, social function, and motor skills. Rett syndrome is a brain development disorder that usually only affects girls. It is characterized by normal growth and development early on, followed by a slowing of development, loss of purposeful use of the hands, distinctive hand movements, slowed brain and head growth, problems with walking, seizures, and intellectual disability. Pervasive developmental disorder not otherwise specified is a severe and pervasive impairment in the development of reciprocal social interaction or verbal and nonverbal communication skills, or when stereotyped behavior, interests, and activities are present, but the criteria are not met for a specific pervasive developmental disorder. Some characteristics of individuals with autism or another autism spectrum disorder include no real fear of dangers, apparent insensitivity to pain, avoiding eye contact, echoing words or phrases, and difficulty in interacting with others. Autism spectrum disorders and the brain. Brain imaging studies have shown that abnormal brain development beginning in an infant's first months may have a role in autism spectrum disorders. This theory suggests that genetic defects in growth factors which direct proper brain development cause the brain abnormalities seen in autism. It's possible that an infant's sudden rapid head growth may be an early warning signal which could help in early diagnosis and treatment or possible prevention of autism spectrum disorders. Causes of autism spectrum disorders include genetic factors and environmental factors such as exposure to toxins, complications during pregnancy, parental age, and family medical conditions. Some researchers suggested that vaccines cause autism spectrum disorders, but nothing was able to prove this yet. Some signs and symptoms of individuals with autism spectrum disorders include social impairment, such as making little or no eye contact and responding abnormally when others show anger or affection, communication issues such as delayed language development and repeating words or phrases that they hear, known as echolalia, repetitive or stereotyped behaviors such as having a focused interest and keeping to a strict specific daily schedule is another sign of having an autism spectrum disorder. The first step in diagnosis is screening at a child well visit at the doctor's. Screening instruments are used to tell the doctor whether a child needs more testing. If a child shows developmental problems at the screening part, they will be referred for a more thorough evaluation. This evaluation is done by a team that includes a psychologist, a neurologist, a psychiatrist, a speech therapist, or any other professional experienced in diagnosing autism spectrum disorders. The evaluation may assess the child's cognitive level, language level, and adaptive behavior. The comprehensive evaluation may include brain imaging and gene tests, along with an in-depth memory, problem-solving, and language testing. Other problems people with autism spectrum disorders may have include sensory issues, problems sleeping, intellectual disabilities, seizures, Fragile X syndrome, which results from a change of a single gene, tuberous sclerosis, which are non-cancerous tumors that grow in the brain and other organs, digestive issues, and other mental disorders such as ADHD or depression. How can individuals with autism spectrum disorders benefit from instruction? Teachers can support social interactions among all the children in the classroom. They can also make events predictable by developing a schedule and avoiding any surprises. Teachers can communicate directions and consequences clearly and carefully by not using any slang and using direct statements. They can also foster positive participation by enhancing verbal communications with pictures, telling the individual when behavior is proper and correct, and providing useful feedback. They should also make students with autism spectrum disorders feel as comfortable and normal as possible. Social relationships for people with autism spectrum disorders are extremely important. These social relationships gives people the social support and assistance they need. If they do not have these social relationships, they may have trouble in school, at home, or in the community. Treatments for individuals with autism spectrum disorders. Children who receive early intervention are more likely to see improvement in language and cognitive skills. Some medications could reduce symptoms that cause problems for a child in school or at home. Parents who work with their child's school to get their child's help have seen the benefits of doing so. The Autism Awareness Ribbon. The puzzle pattern of this ribbon reflects the mystery and complexity of autism. The different colors and shapes represent the diversity of people and families living with this disorder. The brightness of this ribbon signals hope. Hope through research and increasing awareness in people like you.